Just to say that recording has happened. It has started and closed captions are available. The chat box is there so that you can say hello to each other. It'd be really good if you could. And so that we can see who's in the room with us. And then the Q&A is there. And if you can put your questions in the Q&A, just because the chat often's really busy, and then I'm terrified I'll miss some of the questions that me and Sarah will want to address with you. So, and again, just for confidentiality, we appreciate if you don't take pictures of the speakers or screenshots. So we're going to get going, and this is going to be a really relaxed, and so we can just, I think, close down the slides for now. Brilliant. Sarah, thank you so much. I am so delighted that we have you here talking to us about patient partnership, because patient partnership is something that's extremely close to my heart, but also it is our strategy as the organisation, so I suppose that's good. And you've been on my radar for quite a long time. So when I joined the Patients Association 6 years ago, I saw an article with you on in the Evening Standard, and I know you're going to tell us the story, but it was pinned to our notice board in the office from that day on to keep reminding me about why patient partnership. So, you know, you were instrumental in the thinking about our strategy as well as an organisation. So thank you so much for joining us. So do you want to just introduce yourself and maybe tell us what started this journey for you?
Oh gosh, thank you so much indeed, Rachel. I'm absolutely, gosh, pinch me moment to be here. And I just want to start off by saying a huge thanks to everybody who has been part of my journey, who has got me to the Tuesday, the 26th of September at 12:04, 2023. Are we still in? Yeah, good. And without everybody who's been part of this, you know, I wouldn't be here with you at this moment. So yes, hello, my name is Sara Turle, and I am a passionate patient partner, having worked for a number of years with the wonderful trust that saved my life and saved my soul, really, in giving me an identity, again, when my identity went, but I'm going to get back to that. And I'm also a proud member now, working together with Kent Medway Cancer Alliance and also NHS England with the Cancer Patient Public Voices. So that's a bit about where I am, but how did I get to this? You know, because 13 years ago, I was very, very happy working in education. I was in pastoral care, working with the most wonderful children, many who were struggling, and their families. And, you know, I loved it. It wasn't my first career. My first career was in food and beverage management. So, you know, incredible diversity in what I've been doing. So life was poodling along, as it does. And I had literally just had my 50th birthday. And we'd actually had a party, a little bit of a gathering, which we never usually did. Life was good. Life was in a good place. My son was in his final year at university. My daughter was in her first year at university. You know, we were in that sort of place. I just hit 50, and then bang, April, 50 years old, and a serious breast cancer with spread suddenly entered my life. And, you know, you never expect it to happen. You never expect it to happen. And I remember getting a message through saying I had the choice of 2 trusts I could go to be treated from where I lived. And I absolutely know that either one that I chose would have been brilliant. But, oh my God, aren't I so glad I went with the one that I did. And they just took me on, and I had a lumpectomy. I had 6 courses of chemotherapy. I had 6 weeks of radiotherapy. I was then on Herceptin, which was the wonder drug that has kept me alive. And I had an anaphylactic reaction in it and a neutropenic sepsis. And I'm alive still, 13 years on. And all I can say is that it did change my life. There's no question about it. It changed my life. I went back to work, but the side effects of treatment, which weren't me worrying about cancer coming back or anything like that, but it was the cognitive impact. And I actually feel very when I hear the word chemo brain, because I feel as if it plays down what actually I was going through. So when I started seeing it being referred to as mild cognitive impairment, I actually felt a lot better. I thought, this really is what I'm going through. And so I really did battle on. And I am going to use the word battle in that case, because, you know, I did battle on to keep my career and keep going and everything. And my career actually really took off as well, even further, once I'd gone back after cancer. But 4.5 years post-cancer diagnosis, with the impact of everything that was going on, I actually brought my lifetime of working from the age of just 17 to a halt. And I didn't bring it by sort of going off on sick leave or taking early retirement or anything. I wanted to just go out, hold my head high and walk out. School would have kept me under any circumstances. The fact that I couldn't even, the day that I made the final decision was one where I went into my office at 6:15 in the morning and I couldn't work out how to turn the computer on. And that was it. And school said, you don't ever need to touch a computer again. You don't need to this. But I just had to walk out with my head high, and that was it. So moving very, very quickly on, I brought my career to an end. And I'm at home, and it's literally 1 week on from my career coming to an end. And I've got the local newspaper, the local Guardian newspaper that you used to pay to buy and everything. And the banner headline on the front of that Guardian newspaper was that the trust that had saved my life and that had cared for me so well was in the, let's say it's the top 10 for worst cancer patient experience. And this was with the then Macmillan patient experience questionnaire. It's now run by Picker. And it's a banner headline. And I'm sat at home and I think, oh my goodness. And I think, first off, I think, my God, if I was going to that trust, not having had my experience, not knowing anything about them, I'd be traumatized. I'd be so anxious about going. But I also knew it wasn't my experience. So I actually, as you do, or as I do, I actually emailed the reporter, who sort of came back to me pretty quickly and said, well, this is the facts. And I said, well, yeah, okay, I'm not saying they're not the facts, but that's not my experience. And by then I'd done a deep dive and into the questions. And yes, there was no question about it. There were things that could be done better and all those sort of things, but nothing that necessitated that banner headline, top 10 worst cancer patient experience. Goodness me. So anyway, the paper, they must have thought, what a nutter they've got on their hands here. So they offered me, they said to me, would you like the right to reply? So I said, okay, all right, I'll have the right to reply. So literally, we're talking now a few days later on. So I'm still within 2 weeks of having given up my career. And there's a cameraman in my conservatory, doing with me sort of like doing my reply as to why I disagreed with this, and you know what I thought about the trust and about my cancer care. And it then got put in the local paper the following week with an article, a small article which linked to the film, and then that was out there. And I hadn't spoken to the trust about any of this, but you know what? Right there and then, Rachel, looking back, that was my start of patient partnership, because you know what? It's right, it's there. The facts were there, but it wasn't my experience. And I wanted to stand up and, you know, sort of say, okay, so this is the case, but this is what I want to add. And there and then, that is where it all started.
Fantastic. That's really passionate from you, and you can hear the passion, because you've gone through so much, and actually you can see why you were probably really good at pastoral care and that fairness. And you were at the last couple of sessions that we did yesterday with Bola and with Henrietta Hughes, the Patient Safety Commissioner. And for me, what was coming out of there was there's two words there that you kind of, about kindness and trust, and curiosity, another word that came out quite a lot yesterday. And you had all those feelings, but why did you think the patient partnership was the thing? What made you grasp at that?
Well, you know, that's a really good question, and I don't know how I'm going to answer that. It didn't just happen. It sort of I don't even know whether it was organic, but it sort of just came along. Yeah. So do you want me just to tell you a wee bit about how?
Tell me, I was going to ask what happened to the hospital after that then, when they saw done your right to reply.
Right. So I actually got in contact with them and said, look, hello, my name's Sarah. And, you know, I've been one of your patients, and, you know, I've done this. I thought you might like to know about it. And then at the same time, things began to happen. My oncologist had spoken to the Macmillan manager at the trust and said, I've got this patient who really is keen to help and get involved. That happened. Then getting signed up for being a volunteer and everything, that sort of happened together. So I was sort of beginning to get involved with the cancer side of things. I was part of the health and well-being days. We just were looking to start doing health and well-being days for cancer patients post their treatment. And I was brought in and part of that, and I did a bit at the end of those days and everything. So it was very much with the Macmillan manager. But then what happened, and this was all happening very, very closely together, was one day I was in the hospital, and it was the canteen, the hospital, the restaurant that anybody could go into. And there was this section at the doorway which you could buy sandwiches and salads at. And I was there looking for a sandwich or a salad. And then there was this gentleman stood looking for a sandwich or a salad. And I was sort of peering at him thinking, do I know you? Anyway, again, oh gosh, as I do, I didn't just think, did I know him? I actually looked at him and I said, excuse me. I said, are you the medical director? And he went, yes, I am. And who are you? And I said, oh, hello. I said, my name's Sarah. I received cancer care from you, and I was very, very happy. And I've just made this film, or I've just done this right to reply with the local paper, and I'm doing a bit with cancer services, Macmillan manager, etc. And in literally, I'm not kidding you here, Rachel, in this mad, possibly 4 minutes of this crazy woman grabbing him as he's trying to get his sandwich or his salad, he saw possibilities. And oh my goodness. And you know what? Within 5 minutes of this, he had said to me, look, he said, I've got a few things going that I'd really appreciate patients' viewpoint on. Could we make contact? And within a week, we'd had our first 6:30 in the morning meeting, because he got in early and I was an early riser. And it all began then. He wanted me to come along and join the very newly started patient safety summits. And that leads you into, obviously, the article that you saw in the paper. And the patient safety summits were just something else. There's so much I can say. I think the thing about, I do need to just quickly go back and say about the medical director is that for me, that was key to the absolute depth of patient partnership I've been able to get involved in. Because he, and believe you me, he was brave. And anybody who thinks about this, I recognize the bravery, if people haven't done this before, that it takes. But he had the key to open the doors. And oh my goodness, did he open the doors to the inner sanctums of healthcare. And he did it, but he didn't just open the door. He walked through those doors with me. And I think that for anybody, any organization taking on patient partnership, absolutely, truly, you've got to have these people involved who can open the doors and walk through with you. And, you know, I'm going to pay a tribute to the patient experience team, absolutely phenomenal, you know, and this was with the trust in London. You know, everybody was working together on this. But I think everybody can do this, but without, you know, your CEO or your medical director or the real top bods, you know, they can sit and say, yes, we believe in this. Yes, oh yes, patient partnership. But unless they walk the walk and talk the talk and open the doors, you'll never get to what I actually believe I've managed to get to.
You've absolutely you've nailed it. Sarah, the thing that I often think about quite a lot is that culture and leadership.
Yes.
And what you have described there is that culture and that leadership that has the courage.
Yes.
Because you do talk about bravery, the courage to say, actually, if we do this together, we will do this better. Yes. So you have 73, 74 people listening to you on
my gosh.
Sorry to that. Sorry to, but you can do it. But it's for somebody new on the call that is saying, how do I do this? It's very hard. How would you advise they do it? Because somebody there is saying, that it was your positivity that probably opened the door for you, that they saw that you wanted to work with them to continue some good change. What would you suggest to people as they try to start their journey in patient partnership?
So is this we're talking about? So are we right? So there's the two ways of looking at. I think that the big thing that worked was building trust. Building trust. So it's people are anxious. Listen, patients getting involved are anxious. The organization are going to be anxious. All right, I understand that. I totally understand that. So it's about building trust. I think that what I would say is think about, why are you really doing this? Why are you really doing this? And I think that what has really served me well is that I have remained consistent in my understanding of why I'm doing it for myself, and expressing that and working together with people on that. So what do I mean by that? I mean that this constant message I've said, do with me, not to me, together. You know, not you and us, but we together. And what I have always done is that, and believe you me, there's been lots of challenging discussions. This hasn't all been happy, clappy, all the time and everything. But I have always, always, always respectfully and in the correct manner had been involved in those more challenging discussions. Never, ever, ever being loose-lipped or, you know, or anything like that. To, you know, obviously I'm on Twitter a lot, all right? And in fact, I was encouraged by the Trust to go on Twitter, and it's been or Twitter or X, oh my goodness, how ridiculous. I was, oh goodness me, the X factor. But, you know, I was encouraged to do that, and it has been a wonderful, wonderful forum for that, continuing that message. I think what I would say is that I'm very proud to say that I feel as if I'm safe hands. I'm safe hands, but that doesn't mean that I'm a tick box walkover, because I sure as heck ain't that. You know, I really am not that. But I think it's about building that trust. And I mean, like, taking you back to the patient safety summits. This was just, we were just, and this, and I'll just be very brief in sharing this. This was a safe environment for the organisation to look at incidents where things didn't go as well as they should have done, didn't go right. It wasn't the official looking into. This was an additional thing where a group of people from all around the hospital, all different roles, etc., could get together once a week and look at a case and take away the learning from it. But this was, you know, this was groundbreaking in any organization's setup. But to have me involved from 10 weeks in was just unbelievable. Now, I was quaking in my boots going in. I was like, my heart was just boom, 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 boom. And I thought, oh gosh, all you medical people, surely you can hear it. Because I was thinking, oh my goodness me, I'm nervous. How are they going to be reacting to me? They must have been nervous, going, oh my goodness me, and we're going to be. But, you know, we built trust. Right from the very beginning, I went in and I said, look, this is who I am. I'm here because I am here to work together with you. I'm here together. And that I have never, ever, ever, Rachel, stopped saying, you know, and we built trust. And very, very quickly we built trust. And, you know, there were comments like when I wasn't there on a couple of occasions, I was hearing how people were saying, now, what would Sarah have said if she had been here? You know, that is the biggest whoa, you know, for me,
Yeah.
hear that.
And how did you engage then with more patients, try and get patients to get involved in your kind of mission around patient partnership?
Oh, absolutely. So this was me very much, but then the, you know, patient experience team, we got together a patient partnership council. So there were a group of us, you know, who were, and with the patient partners, it was obviously we're volunteers, but like all wonderful, wonderful volunteers, gosh, thank goodness for all the volunteers, who do different roles. Our role was more strategic. But I need to say to that as well, Rachel, that yes, it was more strategic, but my absolute, the win-win-win for me at all times was being out there on the shop floor, out and about, you know, hearing, speaking, listening, talking, feeling, smelling, everything, the experiences that, you know, patients, relatives, and staff were having. And
you brought back into that strategic council.
Spot on. I brought it back in, and, you know, and this was what all of my colleagues on the Patient Partnership Council were encouraged to do. You know, we were out and about, and because, you know, I'm not a medical person, you know, I am just me. And I was going into these meetings, you know, governance meetings, whatever meetings and everything. And, you know, I would think to myself, my goodness, what am I bringing to all of this? But, you know, I could bring, obviously, my own thinking, but it was very, very important I could bring in the experiences that I was experiencing from being out and about. And that, again, I cannot say that enough for anybody who is looking into doing this. And it is a lot tougher now, Rachel, because post-COVID, there's a lot less of getting out and about, and, you know, it's so much more online and all of that sort of thing. But, you know, wherever you can, get out on that shop floor, get out on that shop floor. You know, I tell you this, Metro Lady. So I became known as Metro Lady. Yeah. Again, do you know what? What a career I've had. Metro Lady. I loved it. So I would come into the trust on days I was in, and I was in quite regularly. And I would pick up a pile of the Metros at the entrance. And I would take them into the outpatients areas around, obviously always a big concentration on the cancer areas, but I would do the outpatients as well. And I would just go in and I'd go into the waiting areas. Good morning, you know, I'm Sarah. Would you care for a Metro this morning while you're sitting with a little bit of discussion, a little bit of, you know, putting people at ease, but I'm able to sense how things are going. I'm able to, you know, and I'm not doing that like a CQ, is it CQC inspector? Oh God, I don't know.
Yeah.
All right, sorry, I'm getting mixed up with thinking about Ofsted. I'm not doing it like that. I'm doing that to genuinely get the experience, to genuinely think, oh gosh, isn't that a nugget of brilliance I've just overheard, you know, between a member of staff and somebody maybe, or, you know, what have you. But I picked up on so much, and I would go around and I got so known, people would say, oh, it's Metro Lady.
That's fabulous. Somebody in the chat is saying they love it, Metro Lady. But so there's something about power here. When I talk about patient partnership, and I talk about healthcare professionals having the confidence to hand power to the patient, and then the power will get shared. It's not about one person holding others. There's something about the experience you had back then that, you know, that senior clinician that you met, the director of the clinical director. There was something about the culture, and I mentioned culture a minute ago, but there's something about you were given the power to do this piece of work by the hospital, and you took it, and you worked with them in a positive way. But because to be able to go around and do the Metro Lady business meant that staff didn't see you as a challenge. They saw you as somebody who may raise issues, but you were going to deal with it in a positive way or something.
listen, what I think I have done is, I hope I've just challenged thinking a bit. You know, I think that, again, it very much has come from the fact that it's always been together. It's always been together. So people know that the outcomes, we're all looking for the same outcomes. We're looking for better experience for patients and better experience for staff. And that is the bottom line. Absolutely. But yes, I was allowed, and I was trusted to be out. But I earned my trust as well. I don't really know how.
Yeah, no, it'd be lovely to be able to kind of bottle it and work out how it works so well, because we've heard of people trying to be partners and not be listened to. We time and time again hear negativity around, especially when something's gone wrong in a health system, that it's down to patients not being listened to.
Right.
And the positivity of your story,
Right.
because your story doesn't finish there, does it, Sarah? Because you've gone on and done lots more.
Yeah. So do you want, at this point, because there's been so much I've been involved in. I mean, I just can't get my head around, the Patient Safety Summit's quality improvement. I was involved with Virginia Mason pieces of work right from the very beginning. But I do want to just come to something which is very, very tangible of what I've been involved with. And these are our cancer films. And the cancer films. So the first cancer film came, and this resonates with what both, I've written their names down so I don't forget, Bola and Henrietta yesterday were talking about. It resonated so much because they were talking about, how do we reach the people? How do we go to catch people? And it's not just through leaflets and all this sort of thing in many languages. And the thing that came up a couple of times yesterday, probably more than that, was how films and things like this help us reach people. Well, back in 2015, so it was back in 2015 when all this was happening, I suddenly thought, what would have helped me? And I thought, do you know what? Film showing me things about cancer and, etc., where you come in and who you might see and what might be happening. And so there I was. And this again, Rachel, was in the early days. I said, I put it to the trust. And they said, yeah, that's a really good idea. Let's work. And there was an idea that it might be ready in about 4 months for the AGM. Well, I don't think any of us quite had a clue how the magnitude of making this film would be. And I was linked together with another lady another cancer patient, absolutely brilliant, brilliant, brilliant. And she had actually raised money to help the trust in some way. And so this was a film that came together. It was made by patients, for patients, funded by a patient who had been raising money brilliantly. The original team, it was, the Macmillan manager, medical photography. My God, our wonderful medical photography. They've been used to filming, little, I'm not going to say little, but, procedures and taking photographs and everything. Suddenly they're on, they're making films, major films and everything. So the cancer films came along. So we had Getting to Know Us first. And then a few years later, we did Getting to Know, not radiotherapy, chemotherapy. And I've chosen 3 segments out of that film that I hope we're going to quickly show. The first one is a little slot, and it's the name checking and chemo delivery. And we're going to see that. The next one is a little slot on hair loss. And the last one is a little slot on feeling low, because I think that these really do show what we were hoping to do from making these films. So I'll be quiet now.
Fantastic, and we're going to hope that the technology...
Every time you have chemotherapy, the nurses will ask you your name and date of birth, and then will check this against your hospital notes and chemotherapy prescription. You will be asked to wear a name bracelet. You may be asked a number of times to confirm your name and date of birth. This is not to annoy you or because staff don't recognise you, but for your safety. Everything should stop for ID and be given your fullest attention. This is extremely important in ensuring you get your correct treatment. To be able to have intravenous chemotherapy, the nurse will have to gain access to a vein. This is called cannulation. The nurse will insert a cannula into your arm or back of your hand. A saline drip, which is salty water, will be attached to check that the cannula is in position in the vein and that the saline flows well. Two nurses will then check the chemotherapy drugs against your prescription and ask you to check them too. Again, we ask for your fullest attention on this key check. The chemotherapy will then be given via the drip using an infusion pump. The time this will take will depend upon which drugs you have. Some are given via a syringe and some as an infusion via a bag of fluid. If at any time you feel any pain or notice any redness, swelling, or strange sensation near the cannula or further up the arm, then please let the nurse know straight away. Occasionally, the chemotherapy can leak into the tissue around the cannula if it has been dislodged, and this will need immediate treatment. This is called extravasation. Also, if you feel any strange sensations, flushing, or tightness of chest, please let a nurse know straight away. Occasionally, patients can have an allergic reaction to certain drugs. This can be unpleasant, but the nurses are specially trained to treat this immediately. I had an allergic reaction to one of my chemotherapy drugs. It was obvious within a matter of a few short minutes that something wasn't right. I felt a tightening in my chest. Whilst being a really frightening experience, the immediate response of the caring staff, who calmly and reassuringly took control of the situation, helped me immensely. If something doesn't feel right, call your nurse immediately. Once the drugs have been safe.
Okay, I think we're just lining up the second little bit, which is hair loss, because hair loss matters a lot to people.
So this is some photos of when I had cancer. Not all chemotherapy will cause hair loss, although we know this is the side effect most people think about and understandably can be concerned about when they hear about chemotherapy. If your chemotherapy causes hair loss, you will be told before you start your treatment, and this usually starts to happen about 2 to 3 weeks after your first cycle. The thought of losing my hair was upsetting at first, but not nearly as bad as I had imagined. It was quite empowering, really, as I took the decision to shave it once hair loss had become obvious. I had a wig, but normally wore a selection of hats and bright, zazzy, colourful scarves that made me feel really good. My hair grew back like a baby chick's feathers, all soft and fluffy, but after a period of time, new growth brought real vitality and gloss.
A diagnosis of cancer is really tough, and often the first sign of feeling ill is actually the chemotherapy treatment itself. All feelings are okay. It is absolutely normal to ask, why me? To feel angry, sad, and every other emotion you can think of. The most important thing is to express these feelings and to let staff know if these feelings are becoming overwhelming and difficult to deal with.
Getting out in the fresh air as much as possible, in the garden, walking, and as I'm a runner, running when I felt able really helped me. Showers and runs were my time for tears. Having things to look forward to was important too. Recognising that yes, I would have bad days, but yes, I would have many good days too.
Taking my dogs, Millie and Kerry, out for walks gave my life normality when everything else felt far from normal. Just doing things that I enjoyed when I was able to, that made me smile and feel happy, really helped me.
They are really, really moving, Sarah, and the things in the chat saying, you know, that it's so important to see things from a patient's perspective.
Absolutely.
We did a project recently with Bart's NHS Trust about a centre for metallic conditions, but we brought together patients and clinicians into a focus group, but both parties were like, oh, you know, having this time to really understand it from a patient's perspective is really, really important, and we need to do more. And there's somebody in the chat that's asking a question around time. Somebody saying, you know, I would love to get more involved, but you know, time is an issue because and can people get involved for as little or as much time as they want, or?
Well, I think absolutely. I mean, it really is about what you can bring. So, I mean, I would say, I mean, if it's a hospital trust or anything, get in touch with the volunteering department. That's obviously going to be your starting call. Or if you are, let's say, if you're undergoing or you've been undergoing treatment and are in contact with people like I was, to make contact and say, you know, I'm really interested in working together with you on something. You know, how should I go about it? What opportunities do you have? You know, there's your GP patient groups. Again, you know, the GPs, they have to have patient groups as well now. So, you know, there are opportunities, but I think the first thing is not to worry about how much time you can give. I think the first thing is to take that passion, take that desire to do something, and just get into wherever you're thinking that you'd like to offer that to work together, and just start a conversation. And of course, what we've been talking about a lot, and I'm conscious, oh gosh, I'm conscious of a ticking clock here now, Rachel.
I've got a ticking clock.
Oh my God, I know. But we've been we've been talking about patient partnership in the general side of it, and I'm just very mindful. I just want to talk about being a patient partner for my own healthcare, if I may. Is that okay? Just to say, so you know, I've obviously been talking. I'm known for doing what I've been doing more as within the NHS and what have you. But I am also very much a patient partner within my own healthcare, and I think that we talk about so much about this, and we talk so much about the challenges on the NHS, which, my God, I mean, I've been talking about them for the last 8 years, and I've never known it as much. And that's from me being a patient going in and out now as well. But for me, it's about not sort of going, like, for instance, all right, oh gosh, I'm getting a bit mixed up here. So I'm going to just apologize and say, I think it's very, very important to say that 6 months ago, I was diagnosed with an incurable lung cancer, a totally standalone cancer. Blow me down. You know, it wasn't even a metastasized, which I could have potentially accepted. But I have been kept going for 13 years, living beyond my breast cancer diagnosis. I'm now got a standalone lung cancer, and it is incurable. And we are looking to, you know, at the moment, sort of 18 months to a few years. But I'm seeing my oncologist tomorrow, and hopefully I'll get good news that we are holding back the tide of that lung cancer. So that's just to quickly sort of say why I'm talking about the fact that I am now very much, again, involved with my own healthcare. And believe you me, Rachel, I have never, ever put into practice more what I've been saying about how we need to work together with our own healthcare. Never more than now. And I just want to sort of talk through a couple of the things that have really helped me. And I can only ever say what's helped me.
Yeah.
And that is about, we need to treat each other as we want to be treated. Treat each other as we want to be treated. Respect what each can bring. I think as a patient, and it can be hard at times to do this, but I so recognize and show understanding to the pressures on staff, you know, really, really, while wanting the best for myself, recognizing the pressures and saying to myself, well, what can I do to help in this? And this is where I come to the one constant. As a patient, you are the only one constant within your healthcare. So, you know, getting ready for tomorrow, down on my floor, I've got my lung cancer 2023 file, which will be going with me to my oncologist with a list of questions, etc. I actually noted this, and it's really strange. I'm allocated 20 minutes for tomorrow. How can, this is the pressures that are on our health people. An oncologist, I've got 20 minutes. We're talking life and death tomorrow. We're talking all these things. So, you know, how can I go in there and make every single second count? It's going in there with my questions. It's going in with my file. It's going in there to make every minute of that time count. And of course, if I need more, I know I will get more. And, you know, but if I don't need to take more, I don't want to take more. I want to do everything I can to work together with healthcare. By doing it, it's giving me the best experience. And I honestly think it's about giving all of us the best outcomes when we do work together.
Yeah, I hope you're seeing some of the chat. You're probably not seeing the chat.
No, I'm not. I'm deliberately not.
I tell you, there's lots of lovely, lovely words about you in there, and lots about how inspiring you are and how brave you are and how positive you are, and sending you all the best for tomorrow. And you know that everyone as Patient Association is keeping everything crossed and crossed. And I think you're completely right. So in the chat box, I put our principles of patient partnership that we have developed with patients over the last few months, and they talk about, you know, treating patients as equals, and patients who are services making sure that patients are fully informed. So the videos and the way they've worked with you with the videos is that. And what you're talking about there, Sarah, being ready for your appointment tomorrow, having the questions, is around that shared decision making and patient partnership, and healthcare professionals having the confidence to do that with you. Because yesterday, as you will remember, we talked a lot about what matters to you. It's the most important question, and that's where I think you get so much strength, is because you bring that what matters to you to everything you do.
Yeah.
You know. But then, and recognizing inequalities, and of course, and a lot of people in there, and you talked about the videos, but a lot of people in the chat as well have been saying, you know, is there a transcript to go to the videos, health inequalities, health literacy videos tell the story in a very different and very personal way. And then the fifth of our principles is around seeking patient input. And the sixth is joining services around patients. So we're coming to, so there's another question I want to ask you. Somebody's saying, is it true partnership where somebody in the partnership is paid, so the healthcare professional is paid? The patient who does all this work with the healthcare professional probably isn't paid, but is reimbursed in some ways by some hospitals under lived experience?
So in my experience, when I was with the trust, I was an absolute volunteer. I always knew that, and that was an absolute given. And I think that with all hospital trusts, I mean, I have no idea. With my experience is that it was a totally voluntarily position. In my role with NHS England as a patient and public voice partner, there are mechanisms for receiving some payment. And I'm not au fait with with it all and everything. I personally haven't chosen to take
no,
that.
I wasn't asking.
No. But Rachel, I do need I do need to say it is so important that people can receive that payment. All right, that is so important. And and because the amount of time you put in is huge. Now, NHS England have definitely got the ways to do that. And I applaud that, and I say thank goodness for it and everything. But certainly with the trust, no, it absolutely was without payment.
Yeah, no, it's just for that person, because I wanted to be aware that there is some level of expenses payment within NHS.
Yeah.
I know that Christiana's on the call. She might have a link to it, and she might be able to put it in the chat. We've got 5 minutes left. I've got so many questions I want to ask you.
Oh, right.
So I think there is another question, and there's another question in the chat. And it's about, you started your partnership on a positive note, which was great. Yes. And that is who you are. And that's coming across massively. But through the experiences that you had, you obviously will have met patients and healthcare professionals who weren't feeling so positive about how it worked. How did you get people to come and work with you positively? Is there like 3 things that you would say to people now at the end of your call about how to bring an experience together in partnership and trying to work in a positive way to
Well, what I would say, because I know we're really, and I don't know if I'll be able to get to 3 or anything, but what I would just say is that certainly with the trust, what we always said is that, everybody always understood. A lot of people will come to want to work together who've not had a good experience. There's no question about that. That has got to have been, looked into and given the right hearings and go through all of those things. I'm not taking away from that at all. Anybody who's had a poor experience needs to be heard, and it's got to be dealt with. I mean, gosh, dealt with, how that sounds terrible to say that, but there's got to be the discussions with the trust, etc., etc. Once that's been done and people feel that they can come and then share the learning, share with like our patient partnership council back in the trust, then that is absolutely brilliant. What we can't have is that things like the patient partnership can't be just a forum for personal matters being brought up time and time and time again. So it is about appropriately going through and resolving or dealing with or having heard the issues with the organization. And then when you feel in that right place, to come and, you know, not having to bring it up, but to be able to move forward, but with your invaluable experience brought with you. That is so, so important. So I would just say, oh my goodness, and it's not all been easy. My God, it's not all been easy. I don't want anyone to go away thinking, oh my God, it's all been positive, Sarah. It hasn't. There's been an awful lot of challenges on the way. There have been moments when I've thought, oh my God, what am I doing this for? Oh, you know, everything. It has, without a shadow of a doubt, been one of the best experiences of my life. And there is an urgency about my life at the moment. I haven't got time to die. I have got so much I want to continue to do with patient partnership. I think today might have come over a bit bonkers and a bit disjointed and everything. But you know what? There's been significant challenges. It's not always hunky-dory, even as a patient working with your own healthcare and everything. But you know what? When we're working together, we can get through anything together. And I would just ask people to really, really, really work together.
Well, for somebody who said she wasn't sure about this, you've got it. The last few seconds, you've done an amazing job. You and people just will send you a copy of the chat. But you know, generous, open, positive, inspiring, wonderful listening. Like that's just in the last few messages that have gone through, Sarah. So
thank you to you, and thank you to everybody who's been part of this journey, and to you and your wonderful team. Honestly, Rachel, it's been a privilege and an honour.
And it's been an absolute privilege and honour for all. So we're going to finish with 20 seconds, I think, left on the clock, and we're going to finish with your call. That is, together we can do anything, and together we can have a health and care system that works for all, and that's the way to do it. So we're going to leave it there with you. Thank you so much for doing it. Really powerful. Everyone on the chat is wishing you the best of luck for tomorrow. I will have everything, fingers crossed, all day tomorrow. Enjoy today, and thank you so much. And thank you so much to everybody for your chats and for attending. It's been really lovely to know that you're all here listening to Sarah tell her story.
Thank you.
A few more really lovely ones. Tops. Wonderful, Sarah. They're all coming through.
I'm just staying online.
Yeah, just wait there for a few seconds and then we'll just wrap up. We're just letting people leave the event.
Oh my God, oh my God. Oh.